I'm Frank Weinberg. I'm a thoracic oncologist here at University of Illinois Cancer Center. I have a PhD as well, and I do a little bit of translational research, as well as I run the thoracic program here at University of Illinois. So, a little background from me. I actually got my PhD first, and my PhD was actually at Northwestern University here in Chicago, with Dr. Navdeep Shandell, and we worked on sort of understanding metabolism and how it relates to lung cancer development in particular. And so that's always been kind of with me. And as I've gone through my training, and I did most of my training at University of Michigan, my residency and my fellowship, and I did research there that kind of started to try to understand sort of the interaction between the lung microbiome, metabolism, and host immunity. And so a lot of the research that I do now is kind of looking at patients with lung cancer or patients at high risk of developing lung cancer and trying to understand, are there immunometabolic biomarkers that we can discover that we could potentially, target therapeutically, or even, from a preventative strategy point of view in the future. And so that's, I have a little lab, a basic science lab here. And so we do mechanistic validation there, but a lot of my work is really translational and focused on patient biomarkers that we can kind of translate into better treatments. So initially, I mean, obviously COVID-19 impacted my training and whatnot because I was in the midst of my fellowship. And so that changed things, right? But how it changed how my research or my research focus, it got me thinking about vaccines and I think tumor immunology more in depth, right? So, the vaccines that were developed around COVID were mRNA vaccines. They had been around for a long time. And I started thinking, could vaccines, alter the immune landscape in a person to make them respond better to immunotherapy and things like that. So actually, initially, when I first got here, I did some research looking at patients with lung cancer who got the COVID vaccine to kind of try to understand whether or not those patients who got the vaccine, were there changes in their circulating immune biomarkers that maybe indicate they might respond better or worse to immunotherapy. So that data, we're still analyzing a lot of that data, but there's this whole area of cancer vaccines and therapeutics, and I think for me, at least, the COVID experience and then the COVID vaccination experience kind of opened my eyes to potentially, are there vaccines that we can implement into cancer treatment?